Hi, I'm Roy Soto. I'm an anesthesiologist at Beaumont Hospital in Royal Oak, Michigan. And today we're going to be talking about drug disposal and how that ties into the pain management challenges that we currently have in this era of the opioid crisis. We are doing this as part of the Great Lakes Partners for Patients for Illinois, Michigan, and Wisconsin, and in conjunction with the Michigan Hospital Association Keystone Center. Today, when we're talking about drug disposal, a lot of this is going to be focusing on the fact that we don't want our patients to end up being indirectly or directly their own drug dealers, and that's from drugs that are left over in the household. As we know, many opioids make it into the community now, and as we know, many people are abusing opioids, with the unwanted effects being that patients become addicted to these medications, and patients who become addicted to the medications end up suffering adverse events, which ends up having tremendous personal costs and public health costs. And so today, again, we're going to be focusing on this disposal aspect of the problem. We know the medications are going to the patients, which we hopefully are dealing with in other venues or different videos. And now we're going to talk about how we can really help to get the medications out of the community once they're there already. We know that Americans prescribe a heck of a lot of medications. This is not just opioids, but this is all medications. You can see on this graphic that about 4 billion prescriptions are filled in the United States every year, and about a third of that medication goes unused. And you can see that's 200 million pounds of unused medications that are sitting around somewhere, either in people's medicine cabinets, under their sinks, someplace that people may have easy access to them, or elsewhere. When we talk about opioids, again, I'm an anesthesiologist, so a lot of my focus is on perioperative medication use. This is a nice meta-analysis from a few years ago that looked at different studies that asked patients after different operations how many opioids they had left over. In other words, how many times did you not use all of your opioids after your surgery? And so just going down the list here, you can see orthopedic surgery patients, about 75, 76% of them had leftover opioids, going all the way down to the general surgery patients, where over 90% of patients said they still had unused opioids left over at home after their surgery. So we're giving people a lot of medications, and the vast majority of our patients, for all of these surgical types at least, including minor surgeries like dermatology or dental procedures, have leftover medicines. So patients are not using all the medicines we're giving them, and the question then becomes, what happens to them after that? The first bullet point on this slide really summarizes that last slide, which says that 67 to 92% of patients report having unused opioids at home. And most people only use a few pills or no pills whatsoever due to the fact that they have actually pretty good pain control. And of the people who have leftover medications, about 70% of opioid pills end up unused. And just from personal experience, I can tell you that my daughter had surgery about a month ago on her elbow, and they gave her hydrocodone syrup to take it home. She's 10 years old, and she used one dose, and the rest of it went unused. And so it's very common for people to take that first or that second pill, but then stop after that because they recognize that either they don't like the side effects of the opioids or they just flat out don't need them. When patients are asked in different studies what they do with their unused medications, 73 to 90% report that unused opioids are kept in an unsecured location. In other words, they're keeping them where other folks have access to those medicines. And when they've asked patients, do you have any plans of getting rid of your leftover medications? In general, there's been really low risk of response to saying that they would. In other words, patients are not willing to get rid of their medications. They don't plan on it, either because it's hard, either because they don't know how, or because they just flat out don't want to. And when you look at what that impact might be, a third of opioid addicts, and these are patients who are addicted to heroin, prescription opioids, or opioids in general, a third of patients who have addictions to opioids report that their very first exposure was from leftover pills that they got from friends or family members. So it was not from medications that were prescribed to them. So again, leftover medications left in unsecured locations can be a gateway towards addiction. And this is just from a few months ago. This is from a real estate website. Just, you know, these crises bring up very interesting problems. And one of the problems that realtors have now on open houses is that people come through when they're touring homes. They specifically look to see if homeowners left any unused opioids behind. And so realtors are now having to tell homeowners to hide their unused opioids lest in case people come in to try to steal them. So it's a big problem, and people are resourceful, and people are crafty, and people know that there are unused medications in many, many homes. So why do we give patients so many drugs? I think the answer to that is complicated. I think if it was a simple problem to fix, we would have fixed it by now. But I think it's easy to prescribe drugs. Before my life as an anesthesiologist, I was a primary care doctor, and in both the military and in civilian life. And people came in and they wanted their dose of antibiotics because they were going to go on a trip, and they had that runny nose, and it was just easy to give that patient that prescription. Probably the drug wasn't going to cause any problems. So I think it's easy for people just to write that prescription and go. I think expectation management is a big deal. I think people have expectations of having zero pain after surgery, and they expect to go home with opioids after their operation. I think that is a uniquely American situation, but I think people really expect to get antibiotics when they go in with a runny nose, and they expect to get opioids when they go in with a headache or a backache or they have surgery. So I think that drives the whole desire or the need or the prescription patterns that are happening right now. I think we give patients just in case prescriptions. As a surgeon, you do an operation, it doesn't really hurt all that much, but I'm going to give you that 30 or 60 pills of Norco just in case you have a lot of pain, so you don't call me on the weekend. And that's probably not a great idea. Talking about non-opioid medications, we know that many pharmacists or pharmacies have auto refills where patients can either by mail or in person get their refills, their medications refilled over and over and over again, which can lead to a whole lot of medications building up in the house. And then certainly insurance companies are really encouraging bulk prescriptions, again, with these online prescribing tools, so that patients can get very, very large quantities of medications. And then if they have a side effect, they may switch to a different medication, but they have the leftovers still at the house. The risks, as we've already mentioned, is that patients can divert or steal these medications, that others can steal these medications, or patients can divert them. Certainly, people can use them for unintended diagnoses. So, for instance, a patient receives Norco for a back operation, has leftover Norco, and then they develop a headache 3 months later, and they take their Norco for their headache, which is using a medication for something it was not originally prescribed. And that's akin to using leftover Keflex that you had for a tonsillectomy for a toenail infection. That's just not good medicine. It's a bad idea. Medications certainly lose potency after they have been around the house for a while. We know that expiration dates are real, and we'll talk about that here in a little bit, how frequently that occurs, that we have expired medications in the home. And then confusions with compliance, I think, happen relatively frequently as well, especially with our elderly populations. Excuse me. The patients may receive a prescription for a medication at one dose range, and then the doctor will change the dose to a different dose, but the patient doesn't get rid of their old medicine. And now the patient has 2 bottles of the same medication at their house, one at 5 milligrams, one at 10 milligrams. And I think that can confuse patients, especially patients who are taking many medications, and can really affect compliance with what the physician or the healthcare provider wants that patient to take. So this is the guidance that we get from the government right now. The graphic in the top left from the Federal Food and Drug Administration says that you should ideally take your drugs to a drug take-back location, which we'll talk about shortly. But if you don't have that available, you should either flush it or not flush it, which I think is kind of confusing because it has an FDA flush list, which means the patient has to then click on that flush list to see which drugs are flushable and which ones are not flushable. And if they are not flushable, they need to go to that second graphic on that right side, which says that you should take your medicines, don't crush them, but you mix them with something unpalatable like dirt or coffee grounds or kitty litter. And then you take the medications and you put them in a bag and then you throw it away after you scratch out your personal information on the label. So I think it's confusing what the guidance we have nationally right now. I think asking people to click on multiple different websites and do 7 or 8 different options can be difficult, and that happens after the patient has had the medicine sitting in their house for a while. Why do we not want our patients to flush all their medications? I think that has a lot to do with the environmental impact of our medications. If you look at this slide, at the very bottom, we have drinking water. Now, this slide I found on a website that talked about where estrogens from birth control pills go, and that's kind of that bottom left-hand corner. But we're instead going to talk about potentially other medications. So my first asterisk over there on the left-hand side has to do with homes. You flush the water down your toilet. It goes to a wastewater treatment plant, and it goes into your drinking water. And wastewater treatment plants do not filter out opioids, antibiotics, or any of these medications. So we cannot assume that the wastewater sites are going to be able to do anything with the leftover medications. On the right side are the landfills. So if you take your medications and you just chuck them in the trash, the medications that get rained on leach into the groundwater, which ultimately go again to the wastewater treatment plants before they come to the drinking water. And once again, the treatment plants don't filter that out. So these medications are coming from multiple different locations, and they're not filtered out when they make it into the environment. When scientists and the FDA have looked at different water sources that people drink, including bottled water, which is only filtered, it is not processed in any other way necessarily. Most water can be found to include minute quantities of antibiotics, antidepressants, steroids and hormones, opioids, non-steroidals, and cancer medications. And again, that bottom right-hand corner says that the federal government does not regulate prescription drugs in water. So these medications are measurable in significant quantities in multiple different water sources, including bottled water, which again does not filter out these different medications. So what do? You're supposed to, again, take it to a drop box, or a drop box location is what it said in that first FDA slide. We're getting much better at this. There are drop boxes in Michigan at most police stations, but not all police stations and not all sheriff stations, which is a shame. It would be great if they could be in every location. There are drop locations in some, but not most pharmacies. And there are websites that show which you can go to. At the bottom of the slide in real small, it says michigan-open.org is where you would go in Michigan to find that little map of the mitten with the blue dots on it that will tell you specifically where to go. Wisconsin has a similar website. It's doseofreality, wi.gov/drug-takeback. And that also has a similar map, which will tell where a patient can take back their drugs for drop-off. And again, it is not all police stations. It is not all pharmacies. In Ohio, it is all police stations. So it would be great if it could be every single one in Michigan and Wisconsin, but currently that's not the case. There are public take-back events, usually 3 to 4 times a year, sponsored nationally. We just had one on April 28th here at Beaumont, and we had 40 pounds of medications returned in a 2-hour period with kind of a fair amount of advertisement we did. So that's pretty impressive that we got 40 pounds of pills in a 2-hour period. If you think about how much a pill weighs, that's a lot. Some pharmacies will sell you prepaid mailers that you can send your leftover drugs back to the drug company. Wisconsin and Michigan law does allow that, but again, you have to speak with your pharmacist for that. Some pharmacies and police departments, as I mentioned, do also take those back. And what happens to these medicines ultimately is that they end up incinerated or chemically digested, and that's a Drug Enforcement Agency rule. So they do not make it back into the drinking water. So it's a safer way of disposing of medications. Now, when we look at what happens when we analyze how many drugs are taken back during a take-back event, this is Indiana's experience. A few years back, they had a take-back event where they analyzed all the drugs that were returned statewide, and they found that the average number of medications returned per person was 10, meaning 10 different prescriptions per person were dropped off, which is impressive. The average years that a product had been expired at the time it was dropped off was 5 years, so people are keeping very old medications around the house. About 58% of the medications that were returned had been prescribed. The other 40% were drugs that were purchased over the counter, Motrin, Tylenol, and a small percentage of those 2% were veterinary medications. And I can tell you that I have some leftover veterinary medications in my house as well. The top 3 drug categories that were collected were analgesics, cough and cold products, and anti-infectives, which is probably what we would expect. And the 24% of the analgesics returned, which was the highest chunk of the analgesics returned, included hydrocodone, so the Vicodins of the world, were what was mostly returned as far as an opioids go. And just interestingly, I know this is not an opioid bullet point necessarily, but when they analyzed how many antibiotics were returned per prescription, it was clear that when we gave a patient a 10-day course of antibiotics, they only took 3.5 days or so. So that speaks towards compliance. So we really do need to do a better job of explaining to patients why it's important to either take all their medications or dispose of their medications when they're done with them. Moving just a little bit towards pediatrics and pets. The graphic in the bottom right here shows that people who are accidentally poisoned by ingesting leftover medications or leftover products are split almost evenly between adults and little kids. It's not so much the teens and the preteens that are, it is the adults and the less than 6-year-olds. So this is a significant problem for small children. And if you remember from a few slides ago, the majority of people who have leftover pills keep them in an unsecured location. So these curious little kids are finding these medications, and they're unfortunately being poisoned by these medicines. Similarly, the American Society for the Protection of Cruelty to Animals reported in 2012 that they received 25,000 calls for pets which had eaten human prescriptions. So not only are we leaving the medications in unsecured locations, but we're leaving them in locations where a pet can get to them, which certainly means that a kid can get to them. Again, talking about pediatric exposure, half of parents who have a prescription painkiller for their kid said that they have leftover medications. So if you have an opioid leftover for your child, you didn't use it all and you keep it. About half of those people said they kept it at home. About 30% that they tossed the leftover medications in the toilet. About 9% of people can't remember what they did with the leftover, which is a little concerning. And only a very small amount returned it to the doctor or pharmacy. And 6% actually did admit that they used it for their family members, again, which is a bit concerning. Now, this reiterates what we already said, which is that 2/3 of, this is talking again about kids, 2/3 of teens who report prescription abuse get their medicine from friends, families, or acquaintance, and that 1 in 4 teens do admit to misusing or abusing a prescription drug at least once in their lifetime. And the reason I put this slide here is primarily because it points to the fact that this is a Walmart slide. If you look at the bottom right-hand corner, you can see the Walmart logo. And as of January of this year, Walmart has partnered with a company called DisposeRx, and you can see the name up there. And DisposeRx is a private company from North Carolina that has partnered with Walmart to ensure that all patients receiving opioids receive a little packet, a little envelope packet of this DisposeRx product. And what the patients are supposed to do, and they're actually, I spoke with a Walmart pharmacist this morning actually, and the Walmart pharmacist said that anytime they have a patient who gets an opioid, they are counseled about the dangers of an opioid, and they're given one of these little packets for free. And they're told that when they have leftover meds, they're supposed to put some water in the leftover pill bottle, dump in the powder that's in the DisposeRx packet, shake it up, and then they can just throw it in the trash. And it does not make it into the groundwater. So it's a binding agent that basically forms kind of a gel concrete substance. So it takes it out of the environment. So again, this is available now free of charge from Walmart. We have a community group here in Michigan that's trying to introduce these into other pharmacies as well. And I think it's a great way in the future of ensuring that patients have a safe way of disposing of medications. So with that, I'd like to thank you all for your attention. Our next steps are clearly to take charge of this problem locally for you. All politics are local, and even though some of this legislation is coming down in the national level or from the state level, it's important that you advocate for this locally in your pharmacy, in your hospital, with your prescribers. Thank you very much.